Hello and welcome to my YouTube channel once again. Today we will be discussing about sepsis as we had already discussed SARS, MODS. Now we will be proceeding to sepsis and will be looking at its features and the steps we can take to save patient from developing dreadful complications. Before proceeding to sepsis, we will be looking at some basic terms which will include infection, what is bacteremia, what is septicemia, and then we will be talking about sepsis. After sepsis, we will be discussing severe sepsis, septic shock and septic syndrome in brief. So let's begin with the sepsis. We had already discussed in our initial video about SARS, which was the initial step in development of sepsis. So what is sepsis? Sepsis is SARS within documented infection. And how can you define infection? Infection is when there is invasion of an sterile organ, when there is invasion of a sterile organ or tissue by pathogen. If there is invasion of a sterile organ or tissue by pathogen, this is termed as infection, and when there is documented infection in presence of SARS, we call it as sepsis. In sepsis, the strategy used is sepsis 6. Sepsis 6 means there are 6 things which need to be done in sepsis, and out of these 6, you do 3 things and you take 3 things from the patient. Like, the things which you do are: you give oxygen to the patient, you give IV antibiotics to the patient, and you give IV fluids to the patient. And what do you take from the patient? You take blood cultures, you take like serum lactate level, and you measure urine output of the patient. So you can remember it as taking 3 and giving 3. Take blood cultures, give IV antibiotics, take lactate, give oxygen, take urine output, and give IV fluids. If we go further ahead and talk about, there are other terms like bacteremia, septicemia. So what is bacteremia? Bacteremia is basically the presence of viable bacteria within bloodstream, which can be transient, as is evident in people who have just done brushing. When you brush your teeth, there is transient bacteremia. We call it bacteremia because there is presence of viable circulating bacteria in your bloodstream, but those bacteria are not actively multiplying and not resulting in a serious and overwhelming infection. If there is viable bacteria within bloodstream which is undergoing active multiplication, which is resulting in a serious and overwhelming infection, we call it as septicemia. So bacteremia is simply with the presence of circulating viable bacteria within bloodstream. If the condition worsens and patient progresses further, and there is development of severe sepsis, and severe sepsis is defined when there is sepsis with organ or tissue dysfunction. So just remember SARS, then sepsis if there is documented infection, and if there is organ failure with sepsis, we call it as severe sepsis. The next term is septic shock, which is defined when there is sepsis with hypotension. Hypotension can be the systolic blood pressure less than 90 millimeters of mercury, or when there is fall by 40 millimeter of mercury or more, with tissue hypoperfusion that is refractory to IV fluid replacement. Remember, if patient of sepsis develops hypotension and patient's hypotension gets corrected with IV fluid replacement, this would not be called as septic shock. The requirement of septic shock is the blood pressure should be less than 90 millimeters of mercury, or there should be fall of 40 millimeter of mercury or more, and this fall in blood pressure should be resistant or refractory to IV fluid replacement, and it can finally lead to organ or tissue dysfunction. Then there is another term which is known as septic syndrome. Septic syndrome is similar to severe sepsis, but in this case there is SARS with end organ hypoperfusion, but there is no identifiable infective etiology. Remember, if there is identifiable infective etiology with SARS, we call it sepsis. SARS with end organ hypoperfusion without any identifiable infective etiology, it is septic syndrome. So that's all. Thank you for watching. Don't forget to subscribe, like